just a couple of comments, sort of, and I do thank Perry for actually mentioning many of the points that I wanted to discuss here in my opening comments, to recognize that the insurance industry really has agreed to a significant number of the market reforms that people have been looking for in exchange for requirement that everybody be contained and be covered under the health insurance system. And just wanted to emphasize why that's important. It really, the fundamental principle behind insurance, whether it's any type of insurance, whether it's automobile insurance, whether it's your homeowner's insurance, whether it's your life insurance, health insurance is really no different in this one aspect. The critical function associated with that is to spread the risk. And that is as simple as saying those people who are more prone to have higher expenses, whether it's because of chronic conditions, whether it's because they're more advanced in age and require more care, as most senior citizens do, that additional expense needs to be subsidized and absorbed by younger, healthier people in the case of health insurance who are going to actually incur a lesser amount of cost in the health insurance system. The other idea would be as they pay into that system throughout their entire lives, as they get older or as they incur costs or as they start to require more care, then they've also funded into the system over their lifetime to also then provide for some of the costs associated with that care as well. So it's critically important to get everybody in the system. One of the things we've had some concern with here recently is some of the weakenings of the discussions around how to get everybody in there, and the mandates that are associated to make sure that everybody is covered in one way, shape, or form in the system. I think one of the things you're going to hear, and we'll have some other discussion on this later, I'm sure, is what are the best ways to do that? Harry mentioned some of the things in place for incentives associated with that in terms of subsidies, the expansion of Medicaid, all things that we think are very appropriate to do in this. Some of the other discussions now are going on the other side is that the younger, healthier people that may just choose, well, gee, it's still going to cost me X $100 a month to buy individual insurance. I would go out and buy a motorcycle. So, and by the way, I'm invincible because I'm 26 years old and I'm not going to get sick, so that's where I'm going to spend my money. If you don't have appropriate level penalties or costs or sanctions associated with that, how do you otherwise incentivize them or require them to be in the system? And there's a lot of discussion now about reducing those penalties to make it much more realistic that they would choose to pay the penalties rather than pay the additional cost to have insurance. The problem with that is that there's no longer the broader mass of population to spread that risk across, and that's going to increase the cost for everybody, particularly under a system where if I don't have to buy insurance until I know I'm going to need it, let's say all of a sudden I find that I'm going to need to have surgery, and I haven't been insured, I can go out and buy the policy tomorrow, have the surgery next month, and I've paid 2 months of premium for thousands of dollars of cost. That's going to be absorbed by everybody else, and that's one particular concern we have with this. Just a couple of comments, and I'll pass things along. Clearly, we think that the current system is not sustainable. Change has to occur. And there's lots of different ways to look at it. One of the things I want to comment in closing on this is that a lot of the discussion now has really been talking about health insurance reform as opposed to health care reform. And I think we look at what the underlying costs are. Perry mentioned a figure that they're going to require that 85% of the premiums have to go toward the payment of care. Right now, year to date for this year, Mountain State has paid out about 89.5 cents per dollar on the cost of care. So that's not an issue for us. The real point is, even with the cost and the level of premiums we're charging today, the underlying cost of care is significantly higher, is rising at a level much faster than the normal rate of inflation, roughly double that and has for years. And even with the cost controls that are contemplated here, they're still looking at the fact that rate of inflation is still going to continue. We need to find a way to deliver care in a much more affordable and appropriate manner. We need to try to address the lifestyle conditions that cost some of those carers, those conditions that are either easily controllable or even preventable by first to have people make changes to their lifestyle and to try to control those conditions from the outside so that they don't end up being more chronic conditions that cost more to treat down the road.
Thank you, Fran. And then Gaylene Miller with the AARP. Well, good evening, and I too thank you all for joining us for this important discussion this evening. I assured George that I would be brief, no matter how long it took. So let me say that there's been a lot of confusion about what's involved in healthcare reform. I think we're shining a light on that tonight. But I think there's been even more confusion about who's supporting what. At AARP, I can tell you that our core goal remains the same. We're fighting for our members today just as we've fought for them for the last 50 years. We've long been committed to reforming America's healthcare system, and our policy and our reform activities are driven by one goal, and that's protecting older Americans and their healthcare choices. We're fighting to protect Medicare benefits, the benefits that our beneficiaries have earned. We're fighting to guarantee that folks will never be denied coverage because of health or age, and we want to prevent anyone from coming between you and your doctor. Specifically, we're working again to protect Medicare and strengthen Medicare, to eliminate waste in the system, to preserve the choice of doctors, to protect the right to make medical decisions, to prevent age discrimination, and above all, to protect the consumer. These are the principles that AARP believes needs to be included in any healthcare reform proposal. And I'm going to be happy to answer any questions that you all may have about AARP's position on healthcare reform as we move through the debate this evening.
Thank you, Gaylene. And finally, Louise Reese with West Virginia Primary Care Association.
Thank you. And at least being last, I can offer some solutions to some of the questions posed this evening. The West Virginia Primary Care Association represents 33 community health centers with 160 locations throughout the state. These health centers provide care to almost 370,000 West Virginians, which equates to 1 in 6. The community health centers are all nonprofit healthcare organizations. They are community-directed healthcare providers, which means they are governed by a local board. And they provide healthcare to all patients of all ages, regardless of the ability to pay. So these providers are open to Medicare, Medicaid, uninsured, low income, high income. It is a community-based service. They are uniquely structured to provide care to low income and medically underserved communities. We appreciate the efforts that President Obama has initiated on healthcare reform. And in healthcare centers around the state, we clearly see the need for reform every single day in our waiting rooms, in our exam rooms, and the struggles that these patients share with us. Approximately 30% of the patients that receive care in community health centers are uninsured. Another 25% of those patients are served by Medicaid. And in 2007, West Virginia Community Health Centers provided $26 million in charity care. That's in addition to sliding fee, which discounts the service based on the person's income. Community health centers are key to successful healthcare reform. They provide high quality, affordable, and preventative care. They also provide dental, mental health, substance abuse, and pharmacy services. As was indicated earlier, that there's a tremendous need for medications, and all the community health centers have access to federally discounted medications. That those savings are then passed on to the patients. A recent study stated that health-centered users require 64% less hospitalization than patients who do not use community health centers. And the reason for that is that there is a different approach to the care that is provided at the health centers, and it is comprehensive in nature and helps to work with the patient to keep them from using the emergency rooms. An expansion of healthcare centers will actually achieve cost savings. Nationally, if health centers are expanded to accommodate an additional 20 million patients, and that is half of what we are saying we have nationally, there would be a $212 billion savings over a 10-year period for the healthcare system.